If a doctor has said to you that your child has a muscle condition called spasticity, you may have many questions about what that is, what problems it can cause, and how it can be treated. The medical word spasticity describes a particular kind of resistance to movement that happens in muscles when they do not receive the proper nerve signals coming down from the brain and through the spinal cord. A spastic muscle will tighten up and resist movement, especially if the movement is rapid instead of very slow. This happens because the spinal cord overreacts to the nerve signals that are coming from the muscles when they're moving. Lacking proper control from the brain through the spinal cord sends out very abnormal signals to the muscles and tells them to tighten up. This can happen from many different causes or dysfunctions or injuries, things that can happen to the spinal cord or brain: malformations, strokes, bleeds, infections, or trauma. The term cerebral palsy, also called CP, refers to one particular type of condition that often causes spasticity. Children with cerebral palsy usually have suffered a stroke-like episode or other form of injury which caused brain damage. For this reason, children with CP may have weakness, and often it can be with spasticity. There is not a cure for cerebral palsy, and there is not a cure for the spasticity that it causes. There are, however, several different treatments which can greatly lessen the disabling effects of spasticity. You see, when spasticity occurs over time, that constant abnormal muscle tightness can cause the muscle tendons to actually shorten and then restrict movement around the body's joints. And this can often cause deformities in the legs, in the spine, or upper extremities. When trying to walk, the legs might crisscross, called scissor gait, or the feet might turn in, either one foot or both feet. Also, maybe up tiptoe walking abnormally. Or the knee might be very stiffly flexed or maybe stiffly extended. And also, the spinal cord can progressively worsen into an abnormal curvature called scoliosis. There can also be abnormal stiffness in the upper extremities, like stiffly flexed wrist, for example. When these kinds of deformities occur and worsen, they often end up requiring orthopedic operations to correct them. There are operations such as tendon lengthening or spinal column fusion or hip surgery to correct them. But it would be very helpful to try to prevent those worsenings from happening. And there are several treatments which, when used either individually or in combination, can effectively reduce the spasticity, which is the force that causes these deformities. They cover the range: physical therapy and rehabilitation services, focal muscle injections, oral medications, nerve operations, medication and infusion pump operations. The first and primary line of defense in treating spasticity are the rehabilitation therapies, the physical therapy and the occupational therapy. These are treatments that help to work on lengthening the muscle by gentle stretching, strengthening the weak muscles, and also maintaining mobility and flexibility and movement across all the joints.